When we look at scoliosis braces and trying to make them more comfortable for patients, we know there's some technology that can do this. First of all, is the type of plastic. Plastics have really improved. And in fact, when you look at plastics in bracing, we know there's varieties. Some braces are very thick and very heavy, and they weigh down the patient. And other braces, like the ones we design, are very thin and they're very light. And as a result of it, they don't weigh down the patient much. So number one is the type of plastic used. Two is the design. If the braces are big and bulky and they're just trying to squeeze, they normally don't contour to the body very well. And then normally they're designed very long, and make it very difficult for patients to sit and move because they're not functional in nature. They're just trying to hold the spine from worsening over time. Where if you have a three-dimensional corrective brace, these are typically molded to the hips and to the waist to be very conforming, and normally they're very hard to notice. In fact, many patients can look better in their brace than out of their brace because their posture looks more symmetrical in their brace than out of it. And then lastly is getting actual improvement. The way to get a brace more comfortable is to improve the scoliosis. Traditional Boston braces or squeezing braces are notorious for getting worse and getting less and less comfortable as the patient wears their brace, because typically that's a sign of their curve actually worsening. Where with corrective braces, patients actually improve. So improvement, as a result of this, the brace gets easier and easier and easier to wear. There's less and less pressure because you're actually getting straighter. So improvement is by far the easiest way to make patients get an easier or more tolerable brace, is to actually make their spine better.